roll in and get settled. Just a little bit of a heads up for those who are already here, we are expecting a full house today. So if the meeting room does become full, people will be directed to a YouTube link where this session will be live. Now, I will send you the link as well to this YouTube link just now in the chat, just so that if you do want to just watch the live stream as opposed to be on the video chat, you have that option as well. Or if you have a tech issue, that could be great too. Of course, the only weakness of the live stream is we won't be able to see your questions as they roll in. So I do want to encourage you, Natalie and I, we're both live here. Do feel free to put any questions you might have in the chat box or in the Q&A box here, and we'll be able to look after you in just a moment. But yes, just again, I'll be starting this in just a moment. Fantastic. As well as that, while we wait, if you are sitting in front of a computer, I always love starting one of these by just having individuals kind of, if you like, just on the chat here, put maybe your first name and the organization that you work with, just so that we can have a good understanding as to where everyone's from today. Oh, yes, your chat is disabled. I'm so sorry about that. Let's see if I can turn that on. Oh, I'm sorry. I seem to have promised something I can't give back to. Yeah, feel free to put that into the chat box, into the Q&A box here. Welcome, Emma. Great to meet you. Excellent. As people are doing that, I do want to let me start today's session. I want to start by welcoming you to the start of Mental Health Month for 2023. I'm really excited that you all have come to join us for this month of different activities. Before I go too far forward, I do want to welcome you to, I want to, in the spirit of reconciliation, acknowledge the traditional custodians of the country throughout Australia and individuals' connections to land, sea, and community. We want to pay our respects to the elders past, present, and extend that respect to all Aboriginal and Torres Strait Islander people today. Just as a means of a quick introduction again, my name's Edmund Tam, and I work as the program lead of the Workplaces arm of WayAhead. I know that sounds a little bit complicated. So just a little bit of a background. WayAhead is a non-for-profit organization working in the mental health promotion and advocacy space. For almost the last 70 years now, we have been running an annual campaign to really engage Australians in a conversation around mental health. Every year, the topic is different. And this year, we'll be exploring the topic of we all have a role to play. And so WayAhead will be running many different activities during this month. These series of seminars, which you've signed into today, is a series around workplace wellbeing specifically. I'm also really excited to introduce to you Dr. Natalie Flatt from SuperFriend to explore this theme with us. She is the Chief Innovation Officer at SuperFriend, as well as being an accredited psychologist and as co-founder of Connect Psych Services. Do allow me to pass on to for the rest of the presentation today. Thank you so much, Natalie.
Thanks, Ed. Thanks for having me, and thanks everyone for coming today. It's a great topic. We all have this role to play, and it's all around, being able to reduce this, stigma But also just to be able to create that level of psychological safety within workplaces, creating that level of authenticity and honesty is going to, and being able to have those special open places, and this is through employees, this is through leaders, it's through the organization, it's also through government. I know that you've got an amazing next 4 weeks, Ed, or 5 weeks, being able to have some fabulous presenters and really getting a very vast snapshot about how we can actually all make that part happen. And so today I'm really excited to be able to talk about, what are some of the areas and what also SuperFriend has actually really even found within their surveys. That really allows for us to shine a light on how important everyone is in the workplace and what we can do by, being that advocate, but also being that listener to be able to create better, safer, healthier or mentally healthier workplaces. So I'm going to get started now. Hopefully everyone can see the screen all right, and please let me know if there's any questions along the way, and we can certainly pause and reflect on certain sections here. But when there is a collective view that workplace wellbeing is a real shared responsibility, we're being able to bring that feeling of understanding, that feeling of empathy and acknowledgement into the workplace. And this allows, individuals and, as that person really to feel supported and also valued and very much appreciated, as their whole identity, because that's what we bring to work. Workplaces does create ourselves as a part of our identity, but we also have those personal attributes that also do come into the workplace, and that can make the diversity really rich in many of our workplaces. But it's so important that also then needs to be acknowledged there. And that's where everyone becomes a part of that. So the colleagues, leaders, employees, a lot with government and other external services, we all have that important role to play in that workplace wellbeing. And so what happens when, us as that employee or that person really, is really starting to struggle and having those signs of a struggle and feeling that it is something they might want to get off their chest, or feeling that is really causing some impact to their productivity and their performance. This is where we really want to be able to create that level of feeling understood, of having that supportive and open environment for an employee to be able to feel comfortable in discussing what might be on their minds. And they may not want to go straight to the leaders. They may not want to go straight to the execs. And having those other colleagues is something that can be really important. And if we put on our employee hat and we are the people right now that really feel like we're struggling, what do we do? Okay, how are we able to be able to communicate what's going on in our lives? And these are the areas that is really important. I love talking about this even as a psychologist and what we're doing at SuperFriend, and the environment, it can be really important just to create that space, that neutral space, and that feeling of calm, because I know even as an employee, that sometimes it can be a really vulnerable place that we're playing in. And finding and being able to find a quiet and calm moment and a calm environment to share what's going on within your life to another colleague, that's really important, just to even ask them or find out what's their diary looking like right now. How am I reading that person I really want to talk to and I really feel like I can trust, and I can actually say, hey, can we go for a walk? Okay, we love using the environment or the nature as that calming element. It's got a lot of fractals in our beautiful parks that we can find ourselves in the cities right across Australia, or if we're lucky that our workplace might be close to beaches. Or anything that can be really outside. It creates that vast feeling, and it can really start to make an individual feel a lot more calm. And that's where we really, as employers, we want to be honest, share that you're dealing with your mental health challenge. You don't need to go into that great detail. I wanted to talk to you something that's quite personal. That is something that, is a really good opening conversation or opening starting point to display to the recipient that you're really struggling in that area. And what might you need? Don't expect the employee or your colleague or your confidant at work to know that answers. But if you can then point them in the direction about where you feel you might be able to get some short-term relief, that can be really, really, really helpful. It could just be something like, I've been facing some challenges and I thought that it might be helpful for you to know. So it could be more so an explanation there. If you need and you feel like you can educate them, please do so. If there's some areas that you feel that could be help with their understanding about how you express yourself, or sometimes, how, you can express through your communication through a certain behavior, let them know, show them the way, give them some of that knowledge that they can come and read about. And that then builds that empathy. That's something that is so important that we want to see in workplaces. Mainly ensure confidentiality. Ask them to keep this private. You might even like to start to say, what we're talking about now, I'd really like you to keep confidential until I feel comfortable taking the next steps. But I just really wanted to get that off my chest. Always remember that not everyone's going to react in the same way. Hey, it's some might not fully understand or even know how to respond. And so for you to even show, if you are sharing this, to say, I don't expect you to actually have the answers. I just really wanted you just to be here to listen. And so this is we understand that, being that employee, that takes a lot of courage. So just being able to also have that empathy, that because you have that courage, that the response, just to weigh and hold lightly the response that you're going to be getting, because the point is you're getting that off your chest, and that will then allow the process to happen. Now, if you're the colleague, if you're the employee on the other end, what do you do? And we do a lot of this work around the Are You Okay? And I do a lot of work around active listening and looking at that nurturing statements. And active listening is one of the key to Rogerian therapy and really the foundation of many areas for really therapeutic support. And it's really trying to understand what that person is going through, and having that acceptance. You may not agree with that person, or you may not agree with their opinion, or that view might be very different to yours. But what we're going to be doing right now is just accepting them as the way they are and respecting them, and having that genuity. When we're in an environment that is a lot more calm and it's a lot quiet, as that colleague, leave your phone in the office. Being able to walk there and walk outside and really giving you 100% undivided attention. If you stop and you sit on a park bench, or you find another quiet area where you can sit down, even your body language can tell the way that you're listening, even with your shoulders down, and your eye contact quite clear, and even the way your body is actually leaning towards that person. And it really is then showing you, or showing them, that you're here for them completely, right here, right now, in this moment. So body language can be a real indicator that you're listening there. And it's not about sympathy in this area. It's about the empathy. It's about trying to understand, putting yourself in their shoes, because that can be that true understanding of how they're feeling right now. And this is where, especially with the area that sometimes we can fall ourselves into, and we don't really mean to, is that we really want to be able to hold, our problem-solving abilities or our skills, because so many of us actually want to solve a problem. We want to be able to help, and we can start to throw these statements out that we feel might be really helpful, but more often than not, they aren't. So I really emphasize, look, using nurturing statements. I'm here for you. I can see this is really hard for you. What can I do to help right here, right now? These kind of statements will show that the person that you are there for them, okay, and you're there and you're not going to be leaving their side right now, especially if you're using that empathy piece. More often than not, this may be even the first time they've even said this out loud, and that can really lead to a lot of feeling of feeling quite even some incredibly vulnerable, and even sometimes incredibly lonely. So being able to show, hey, I'm advocating for you right here, right now, I'm all about you, that can actually be incredibly powerful. And really in that sense, looking at that guidance and boundaries, you don't need to actually have the answers right there, right now, but even going on and saying, right, you know what we're going to do when we get back to the office, let's go and look for the number for EAP. Or let's go and find a quiet spot and call your GP. Okay, you don't need to do it for them, but you could potentially be there with them, because that might be the support they need. And that's where your boundaries also come in place as well. And even though I'm a listening ear, I don't have the answers. Okay, so it's really important that you want to be showing that you're here for them, but you are not here to be their pseudo-therapist or the accidental counsellor in that way, because sometimes that can be very overwhelming for a lot of employees and a lot of people, and it can really actually prevent them from wanting to ask other employees, hey, how are you going? Or like other colleagues, hey, how are you going? When you do get that colleague into the right area and with the right help, just let the process begin and really trust in that process. But that follow-up, a couple of weeks down the line, that can really be beneficial, because it can show, hey, I still care. Hey, I'm still there, for you. And even using those objective observations, like, I've noticed that, you've got more of a smile on your face when you're coming into the office, or I'm noticing that you're feeling a little bit more upbeat. You can use those areas as evidence that, things are moving along, and they are getting that right support there. And we move into the managers, and, so what do we do if we're wanting to chat with our manager and or our leader about things that might be feeling a little bit overwhelming for us right now, or that we are struggling with some mental health challenges? What we're actually finding at SuperFriend is that when we're taking action to support our mental health, our results are actually showing that 13% of employees have sought out help from their leaders and their managers. So we're really hoping that in the next couple of surveys that we'll be running over, or our new survey, is going to be seeing a bit of a rise in that, to really show that people are getting a little bit more, I suppose, feeling a little bit more confident in the workplace, that they can actually disclose their mental health challenges. Open communication, it's a real key for fostering that supportive environment. And your manager's role, includes ensuring the well-being of all their team members. So what we're trying to encourage is try not to hesitate, going to the manager for any assistance that you really require there. And what we are wanting to do here is really being able to, again, show being that direct and that honest, honest communication can be something that is incredibly important, and also knowing when to actually talk to your manager. Again, being able to book that appointment, even writing down some notes can be really helpful. And if you feel that it's something that you may not want to do within the office, trying to find a space that you can actually go and find a neutral environment can really feel a lot less intimidating to many employees there. after you show that honesty and you disclose what's going on in your life right now, explain your needs. What do you need right now? What's going to be able to help you? Provide your manager that guidance. Are you needing some more frequent breaks? Are you needing to be able to work from home, a little bit more often there? Or are you needing a couple more, more of a flexible workplace arrangement in the short term or medium term? What's going to help you right here, right now? And with managers, again, utilising that active listening. We see that within leadership, this is one key component that leaders can really show, is that when leaders have that high EQ, that then will lead to more growth mindset. How can we help you right here, right now? Again, with managers, it's about being able to know that we're always very busy right now, and sometimes we can find that those snippets in the day, it might be between really long meetings, really arduous meetings, but that half an hour gap between two large meetings, it may not be enough for this employee. So being able to be very mindful of what you feel this employee's needs might be, and also try and predict how long some of this chat might go for. It might be a bit of a two-way street with the employee to really find what's going to be best working for you, or if you can shift some things around in the day to be able to provide them the time that they need. But those active listening, it's really imperative, and looking at that reflection and that summarising, just to really create that clarity for the employee, is going to give them a real peace of mind. So what you're saying to me right here, right now, and let me be clear, these are the needs that you feel are going to be able to help you in this current moment. And that will then create that feeling of support and understanding within the employee's mind. Again, respecting that confidentiality is of utmost importance, and again, directing them to the EAP or to other resources that will be within the workplace is again really important as well. Checking in with them, again, I would say even on a weekly basis, is going to be very. It's going to be really beneficial for both the employee and also for yourself, so you understand, where they at, again, from even a workload perspective. If that can be one of the main stresses, just to be checking in on, how they're going. Is there anything else that needs to be altered during this time? Because sometimes it can take those tweaks there. I think as well as, again, it's around avoiding that judgment and providing that advice. Okay. Managers can easily slip into, and we talk a lot to managers about slipping into that accidental counsellor. We work a lot with team leaders as well, and they can find that can be a real source of their own stress. So really, as managers, protecting the boundaries and having those appropriate areas in place is something that is that's going to be really important to be able to support that employee the most beneficial way. Okay, and so then we move into the organisations. So this is really part from our own indicators of a thriving workplace, really around our work design and also the capability. And what we've found in our indicators of a thriving workplace is that 18% of workers sought help from a healthcare professional. So we're looking, that more often is that at those employee assistance programs. Now, 18% is quite a high statistic for EAP. It would be lovely for many EAPs out there who are on the call today to see an 18% usability rate. So it's also, being able to seek other healthcare and resources such as GPs and other government agencies on how to support that. So it's good that we're seeing more of an uptick in the usage and having that awareness created. But it's also then continually about promoting that awareness. We want to be able to, as organisations, really to implement mental health care training. The more information that we can Sorry if you can actually hear some buzzing. I think it's above me right now. But the more we can actually implement those mental health trainings, the better and more equipped our staff and our teams can be. And we can then conduct those mental health care workshops. So being able to have those how-to moments and being able to utilize those practices, those role plays, and being able to work on strategies and case studies and implementation, that will provide colleagues and teams and leaders with that confidence to be able to again ask questions, to be able to see signs and symptoms of what we find most often in the workplace around anxiety, stress, and burnout. They're really the top three that we're seeing a lot of at the moment. We want to be able as organisations to offer employees support, or EAPs within the organisations to the colleagues. But, having those EAPs that really have those diverse mental health needs and have those offerings. And also, what we're noticing a lot more as well, especially in Connect Psych services, having that web content accessibility and those guidelines and that capability of the EAPs can be really beneficial to many of those diverse workplaces there. As I said before, the stress and the burnout we're seeing on the rise, and we've been seeing this, through the COVID days. We're really seeing the ramifications of burnout across both employees and middle management. That's starting to really take some effect there. And burnout is something that we just can't click our fingers at and have some workshop that's going to be able to reduce the levels of burnout. Burnout is management. Burnout is being able just to notice the signs and the symptoms and take those frequent daily strategies and activities to be able to keep and maintain and manage our level of energy throughout the day and notice our burnout, the symptoms that we might be starting to feel, and being able to prevent some of those symptoms from growing. So a lot of workshops around that for organisations is really the key. And we're seeing that a lot, again, with more those work designs that can be a little bit more rigid, or where work-life balance can sometimes be a little bit more difficult to manage. Obviously, in the healthcare industry has been one of the big ones that comes directly to my mind there. Looking at really even establishing, peer groups and peer support groups. What a great way to create that level of validation and also that normalization, but also those go-to people. We see this, being done really well in different sectors, and being able to have that confidence to be able to explain, and have that understanding, and having that avenue of confidentiality can be a real peace of mind for many employees, especially in more gender-dominant areas and industries there. We want to be really creating that supportive environment within our organisations, and fostering that open level of communication, and being able just to address any form of mental health discrimination, because mental health doesn't discriminate. We're all humans. We all have the same set of emotions, and some of those emotions can be triggered by life events, more often than not in the least time we actually expect it. I always like to say that, that sometimes crisis doesn't build character. Crisis actually can reveal character. And that can even take ourselves by surprise at times. So always try and create that empathy that it's not, mental health doesn't discriminate there, we should really try and destigmatize that and use that statement within the organisation as much as we can. Flexible work arrangements. This can be really beneficial for many individuals. Flexibility has has come a long way in the last 3 years, and results have shown that, if handled management, correctly, and having the open channels of communication, that we were able to really show the same productivity and performance, as long as everyone still has that feeling of connection. And some people, especially, with going through the mental health challenges and feeling that today might be a very overwhelming day, or, if I work 2 or 3 days and I feel very overloaded, so being able to work from home in a quieter environment or with all my sensories around me allows me to regulate and to ground myself again to still be able to perform, then that's something we need to take into consideration. Granted, not in every industry. It's something that can be certainly discussed. Managing those workloads can be really important as well. Ensuring the realistic workloads, not to still be able to create that, that work-life balance and prevent the burnout, but also to focus on self-care. If we're not self-caring, and self-care is not selfish, that we are not going to be able to perform at our peak. It's our brains are, like computers, and we do need that little bit of reset, that little bit of switch off. Because our batteries will run low, and sometimes it's not as easy as just taking that time off and to recharge to 100%. If we're consistently doing that and we're consistently showing that self-care, I like to call it coming back to base, something that aligns with who we are as employees and who we are as leaders, and who we are and how we can encapsulate that within our organisation, then we're actually going to have a happier and healthier workplace environment. We want to be able to have those regular check-ins, and again, with the leadership training, being able to train managers for that support, and having managers understand, the signs and symptoms, but again, not getting them to fall into that pseudo counsellor or pseudo psychologist position. That's what's going to also then lead to the leader burnout. So we just need to make sure that they're trained, to provide the element of support and guidance and direction as well. And also just having those transparent policies, and also the monitoring some policies, gathering employee feedback, what's working, what would they like to see more of in the mental health space, what do they see as a trend that might be occurring within the workplace. Sometimes, because they're in it more, they can actually see a lot more. Gaining their feedback and having them as part of that, again, that policy, what we'll then be able to take is that accountability, and also then uptake of the training when it does occur. So that can really be quite a key there. And then, again, with that continuous evaluation. So assessing the effectiveness of this, and if you are going to be implementing a training session or an awareness session or something within the policy, how is that going? What is the effectiveness of that? What is the conversion that we're seeing within the organisation? So again, just having that peripheral vision. We don't want to be doing things just to tick the box anymore. We want to actually be creating these actionable insights and these strategies that are actually going to create a shift in mental health in the workplace there. Now, I know that we've got the beautiful Jim Kelly coming up in a couple of weeks, talking a lot from the government and the legislation area. But, with the government, what we want to be able to do is really looking at, what can we look at from legislation and regulation, enact and enforce laws, that are going to be providing this safe and mentally healthy workplace, and the guidelines around preventing that psychological harm. We understand that, the mental health claims are on the rise. It's no secret to any workplace, any organisation right now. And what we're trying to do is prevent this and reduce this. We want people to be happy and healthy in this area. We want to be able to look at research and also, our data collection. What are we doing? Like, how is this actually, if we can create this collection across industries, and fund this research, looking at better ways to understand our challenges within certain industries, and even across certain states. What can we do to then be able to formulate and then create some evidence-based strategies and workshops to really help organisations make more informed decisions on what's going to be best for their workers and their employees. And this would then allow for those guidelines, and best practice across those 19 industries there. We want to really be able to partner with other industries and collaborate with other industry associations on, again, what they see and what their members see, to help, tailor what's, again, going to be work and best for that workplace around strategies there too. So what can we do by being able to prevent and promote, within the workplace there, with employees? Hey, what can employees actually do? As I said before, prioritising self-care and practice, and that work-life balance, and being able to encourage each of you, as employees, as colleagues, to be able to take those short breaks. That's part of what we're wanting to do and what we're wanting to see more of. Recharge and reduce the stress. Going outside, especially if you are in the city or even if you are working from home, like, schedule that into your calendars. I think a lot of us say it, that we will do it, and the day can normally get away from us. And again, sometimes that can really feel like I do that myself. But it is a continual reminder that if you actually walk away and you're able to gather that stress, de-stress yourself, and you're coming back, maybe to an email or to, a task or to a project that you're working on with fresh eyes. And it's amazing. It's a little bit like the puzzle room, isn't it? That when we can walk away from a puzzle, we can't find that last piece. But if we walk away, take a break, and we come back to that puzzle, there it is. There's that last, or that other piece that we're looking for. That's something that, we want to be able to do, when we can actually take those breaks. It's called diffuse thinking. It then allows our brains just to take that reset of what we were focusing on, to be able to focus on something else, to give that part of the brain a bit of a rest. And the diffuse thinking allows that reset to occur, and more innovation to actually create when we're actually coming back to our task. We want to be offering an active and using that active ear and that listening. As I was mentioning at the start of this webinar, active listening is such an integral part of emotional intelligence and real therapeutic support for anyone who's had the privilege of really feeling heard. It makes you feel just so understood and so validated, and that you make that person who is listening to you, what an authentic, special human that they are. So this is something we can all achieve. And more often than not, even if you have to make that concerted effort to say, I want to give you my all right now, so let me finish this task. Or how about you actually then, do we actually have some time within our calendar later in the day to be able to take that walk outside so I can give you my undivided attention. We don't expect anyone to drop everything at once and then be able to actively listen. That's not the point of that. It's the point of trying to find that calm and quiet time and environment to be able to perform active listening there. And seek help when needed, okay? And know where to get it. So more often than not, I'll get up to organisations in a moment, but being able to have that employee assistance program number or link or email available is really important, and along with some mental health resources that can promote that well-being there. And we want to be able to promote that inclusivity, getting everyone, there's nothing better than to understanding someone from a deeper level if they are willing to be able to want to impart a little bit more about themselves, because that's going to be able to create that level of connectiveness. And that's what we're actually finding in our indicators of a thriving workplace as well. That employees do play that crucial role in promoting good mental health support within the workplace. And that high levels of connectedness, benefit the mental health as well as our productivity there. We want to be able to, really support our colleagues, by pretty much, promoting that positive communication. Okay, so like using that constructive and also that respectful language, and that's going to really be able to help with that diversity area, and that's something that is, again, very important to be able to show and to show that level of respect. Okay, so participating in wellness and wellbeing programs is again really important aspect there, that if organisations are starting to create that, that is something that we want to be able to also include. If we're actually asking this of our organisation, be part of it. Don't be afraid to then, include yourself, because the more people include, the better the data is going to come out, the better the feedback that is going to be provided, and also the efficacy around that. So, when they are on offer, or when the training is on offer, or when the awareness is on offer, or webinars actually being provided, please actually enjoy and take that time out. I think that's again an important component to your own learning and offering as well. Advocate for that safe and respectful workplace environment is also, again, highly important, and that's something that we really want to encourage as employees, especially when we are finding that that there might be some sensitivities that could be lying around when there might be a bit of a change again in management, or a workplace redundancies, or an organisational shift. What are the options that employees can discuss with other employees, and where can they do that? That talks about those change management can cause a lot of stress amongst leaders and amongst employees, and knowing there's been a lot of change over the past couple of years to many organisations, small, medium and enterprise organisations. Everyone's really been touched by this, so being able to have those safe and environments can be really important there too. So what can managers do? Again, when we're looking at that leadership and modelling, leading by example, and also as managers, what are you doing to self-care, and how are you showing that to your teams? This is just as important from a work-life balance perspective there. How are you actually showing? What are you sharing in those meetings? Is there something that you're doing by, not getting to an office at 8 a.m. and then leaving it at 6 p.m. and not actually having any breaks in between? What are you doing as managers to really take that time out to recharge and also to re-energize? What's your value and purpose alignment, and how are you then sharing that with the team? The more human you can actually be as that manager and show that other aspect of your identity, the more your team can actually feel comfortable in sharing how they're going and what they do by way of work-life balance. So that encouragement is very important as that bubble and that protective factor around burnout there. demonstrating that empathy, and again, having that open communication. Emotional intelligence really is the key, as I said before, to that growth mindset, and being able to foster, again, that and valuing the diversity and inclusion around mental health, and just being able to understand that, and not to thinking that this is not just an employee's challenge. It can be a shared challenge for them, because you can be, again, that listening ear that's then going to be able to lead them to the right professional help. So never underestimate that, never assume that. We want to be leading discussions on mental health awareness, and again, any anti-stigma efforts that we can actually place in there. Once we can lead those discussions, and we're comfortable leading those discussions, that's going to then be able to break down a lot of those barriers of access of support. Job clarity, we do a lot of work in the indicators of thriving workplace around the psychological and psychosocial hazards around job clarity, and setting those clear job expectations can be really helpful for employees with mental health challenges there. And fostering the open communication with employees, like continually being able to, having those opportunities from a social aspect to be able to connect with different divisions in different areas, again, allows for that growth, again, allows for those connections, and definitely allows for that opportunity to communicate in different areas, and have those opportunities, again, for growth and for different views of different perspectives of many different topics too. Regular check-ins can be really important, especially with individuals that are displaying some mental health challenges. Weekly check-ins can be very beneficial at the start, but checking in with all your employees about how they're going, how their workload is, what they're doing for well-being, asking them about the tip and how they're actually recharging. Again, it shows that you're connecting with them on a human level, just not on a workplace level there. And having that opportunity to provide, an avenue where employees can express concerns without feeling judged is, again, really important. It shows that empathy piece, but also to say, okay, this is something that we can work on, that we can address. It's a level of feedback that managers can need, that if we don't know, we can't change. So being able to have that avenue of support, or even asking these questions in your check-ins, can be really beneficial to many of the teams. How are we going for time? Just looking at 10 more minutes there. Again, looking at recognition, we want to be able to acknowledge and celebrate employee achievements, whether this is through tech channels like Lattice, where we can actually provide feedback that everyone can see, but even the small wins really can be celebrated. And we look at this even from a behaviourist way of looking that when we are provided positive reinforcement, we're more likely to show that behaviour change the next time round. So being able to feel special as an employee, or as a team, or as a division, because of something that we've achieved, really should be highlighted, and it really does then boost the morale, because this is through recognition. Many studies have actually shown that the more that recognition is better actually through voice, or through email, or through letter, or through just coming up and even having a little bit of a stand up, than through materials. So it doesn't, it's kind of like the best things in life are free. We can just start to incorporate that a little bit more. That actually has shown and proven really efficacious for project management, along for the next project too. Being able to provide that guidance, so actively listening when employees show that mental health challenge, and again, it's something that we don't actually then have to show and impose those solutions. it's about being able to utilize that listening ear and show that empathy piece to be able to provide that guidance into the right channels within the workplace. Along with actually then providing those that confidentiality and assuring that confidentiality, along with respecting the privacy and the boundaries. We don't want to have office gossip. Hey, as managers, there's sometimes when we can be exposed to that office gossip, and that does need to be, within, I suppose, even within the policy, to shut down quite quickly there. If you're leading by example, that style of voice is not going to be tolerated, and what's the style of voice that we would like to be seeing, then employees will hopefully follow suit on that there. We want to be able to provide that regular feedback. So soliciting, that employee feedback on wellbeing and again, mental health initiatives, that will allow for that continuous improvement, and really even being able to partner with the human resources sector, if you do have one, within the workplace. That can, again, allow you to develop the mental health initiatives that are going to be able to support certain teams of certain divisions. So when we actually really have our ear to the ground as managers on what's going to work best for what team, and then being able to work with HR, they're going to be the ones that can then connect in and work with EAP, or any, that can provide their psychoeducation on what's best going to suit that team. So that can be very, very, very powerful and very specific, and you're going to get the outcomes that you need. And from an ROI perspective, you're going to see the benefits there. And then we move into organisations. Okay. So we want to be training the teams and the managers about recognising the signs and the symptoms of mental health challenges. We can't expect everyone to be able to know these, because some signs and symptoms can be a little bit deceiving. We do a lot at Connect Psych around the Are You OK 8-step model, which we've kind of just taken a little bit differently, and put our bit of a spin on what we see. But looking at different signs and symptoms for different areas, and looking at differentiating, certain types of fatigue between, general fatigue to burnout, to vicarious trauma and compassion fatigue. What differences do they show, and then what might be different styles of intervention. Once managers and teams actually know these symptoms and these challenges, they can understand from a cognitive and emotional and also a behavioural perspective where that pattern might be, to where to then to intervene. So again, depending upon what industry, these again need to be tailored to suit the industry and the team and the division there. We want to be working on the meaning of work, so that each employee can really understand their role and their value to foster engagement. We want to be able to be making a difference, when we're working on that project and we're working on that task. What is the bigger picture here? When we can actually feel like we've got a responsibility and that our input is going to create the greater outcome. Employees, you're getting a lot of people to a better buy-in, dare I say. But work only then also creates part of our identity. It is an important identity. It certainly brings in the social aspect. It brings in our purpose. But we want to also be bringing in our personality to our workplace too. So being able to create, our identity around the works, around the projects within our personality, that's going to really create that innovation that we all want to see within workplaces, and being able to have that safe environment where everyone's voice matters, everyone's opinions matter, everyone's feedback matters. You're going to actually then have that greater feedback, along with greater innovation there. A lot of organisations really feel that regular surveys to monitor, the evolution of the employee experience can be really helpful, such as Lattice, and it really does help with those tasks from a weekly perspective on being able to maintain it, but also, being able to say, well, where are the roadblocks for you this week, and what can I help you with? So it again gives workplaces and managers that real structure around how an employee is going, not only from their tasks, but how they're feeling about those tasks. So it can be a very powerful tool there. And ensuring that team members know how to communicate concerns, or asking help, where they need it, and also how to find it. Unfortunately, I've looked at many websites over the years and said, where's the mental health resources and how do we find this? And it can be really hidden away sometimes. Being able to have these in prominent positions within your organisations is highly important. But it's also not about being able to use this only as a reactionary area. It's around about promoting and having those early intervention and having that psychoeducation to say, hey, I didn't know that, or hey, look at this, because we want to be showing that the strength within wellbeing and how we can actually, if we can strengthen our wellbeing in certain areas, that can actually make us feel more resilient. And when we have a resilient workplace or resilient employees, we're actually going to see that productivity from a social impact and also from a financial impact. And basically ensuring the workplace supports the recovery of workers returning to work. What needs to be put in place to make sure they feel comfortable, that they're not feeling overwhelmed, that their workload is obtainable, and also not going to be overly stressful that might put them back a few steps to when they first came back into work. So that is something that has to be handled with a level of sensitivity, and more often than not, that might be based on individual needs there. We're looking at, from our ITW, we're looking at around 26% of workers seek help from family and friends than from their manager and their HR. We want to be able to see, how can we actually start to flip that? How can we create those safe places within organisations that employees do feel comfortable in being able to go to their managers for help when they actually need it? Now, I know, Ed, I'm right on time, and I know that we were talking about, like maybe we can people can create a bit of a snapshot, or we can send these slides around at the end. Or I know the slides can be sent around at the end. But these are some of the discussions, the top 3 questions I'd really love asking workplaces, and getting organisations to have a good think about the how. We do a lot of work around the interrogative voice at SuperFriend, and looking at, how we can create those action-based insights to be able to support and create those thriving workplaces. So really, having a bit of a think about, what strategies has your organisation implemented to prevent harm that have made a real difference within your workplace. And what are some wellbeing strategies that you've used that have had a beneficial impact on your own personal wellbeing at work? And that's from an employee and a managerial perspective. And do you know what wellbeing supports and services are available to you within your organisation? 3 snapshot questions that you even might like to take around. Ask your other colleagues, or if you're a manager listening right now, ask these to your teams, or if you're an organisation, you might want to then pass these down to your managers to get the ball rolling and to get everyone to start thinking, and creating that overall we all have a role to play. Thank you so much for joining the webinar. We'd love to hear from you. If you want to snap the screen, or contact us for any future questions, or any further discussions around who we are, what we do and how we do it, I'm more than happy to assist. And thanks, Ed, for having us.
Thank you so much, Natalie, for sharing. And yes, just quickly, we have a quick link to the SuperFriends website on the chat here. As Natalie mentioned a few times, they have a great document called the Indicator of a Mental Healthy Workplace. It's an annual survey and report that they produce gives you amazing amounts of insight into this area. And then on top of that, yes, we have a link to our feedback form as well. This is the first one in the series that we've done, so I'm sure there's a lot that we can still learn. And so do feel free to fill that in for us. That'll be absolutely fantastic. And of course, if you do have any questions for WayAhead or any other subsequent sessions, our contact details are just on our website. Feel free to reach out and we'll be able to help out as much as we can. Otherwise, thank you so much again for your team. And Natalie, thank you again for your sharing today. And we'll see you next week.
See you. Bye-bye. Bye.